Dear respected farmers, this is Fu, pharmacist of Fountain Animal Pharmaceuticals. Today, I would like to talk what can we do when facing diarrhea. I summarized 5 points. Firstly, we should determine is this diarrhea an individual case or it is cases in your group. The consequences of an individual case is small. It is easy to deal with it alone. If it is cases in your group, we must find out the reason behind so we can handle it properly and can get the right method to solve the real problem. Secondly, if the diarrhea occurs in your herd always, and always in large number, we must think, is this caused by viruses, or bacteria, or parasites? Or is this nutritional problem of your feed, or quality problem of your feed, feeding system problem of your drinking water? Thirdly, we have to establish the treatment protocol after confirm the cause. For example, if it is viral, objectively speaking, there is no specific medicine at present. Maximum, we can use some broad-spectrum antiviral agents, such as interferon, or some biological agents, or a few medicines like ribavirin or metronidazole, but they are not specific, and their effect is limited. On the other hand, fortunately, virus diarrhea's hurt on animal is also limited. Only the symptom harm animals. If we handle these symptoms quite well, the sick animal can recover after a while, because many viral disease has self-healing property. Our focus is providing supportive therapy during its self-healing period, like preventing and handling secondary bacterial infection, like diarrhea healing, and preventing dehydration. Sometimes we need strengthen heart or adjust acidosis. If it is bacterial diarrhea, then we have to distinguish which type of bacteria it belongs to. Is it E. coli, Salmonella, Pastorella? All these are gram-negative. We should choose medicine which is effective on gram-negative, such as gentamicin. Some pathogen is anaerobic, such as Clostridium. Other medicine has no effect, except metronidazole, lincomycin, and penicillin is also effective. And to some specific diarrhea, we have specific medicines, such as swan dysentery. We have Mincodox. Swan enteritis, we have Timulin, Tyvalusin, and Tylosin. Many farmers would say it is difficult for them to distinguish. Then it is necessary to apply combined medication. Combined medication means we use different functional medicine together. Regarding parasitic diarrhea, commonly seen is protozoal disease, causing losing stool, causing intestinal bleeding in young animals. And babesiosis also causes diarrhea in cattle and sheep. So we should identify which type of parasites, because we have different medication for different parasites. Regarding quality of feed, in many cases, diarrhea in young animal is caused by indigestion. Then we should think, what is the cause of indigestion? Apart from young animals' weak gastrointestinal function, there is something they have taken cannot be digested. Like some feed for suckling animal has excess protein, which easily cause diarrhea. or poor quality of milk lead diarrhea on suckling animal. So we should know nutritional standards of our feed, and we must choose the feed which is reliable and which is qualified. Regarding mycotoxin, mycotoxin is a long-standing problem. It is everywhere in your farm. Having diarrhea is understandable if your feed is always in a recent state. I know there are many farms, they do not clean their water line quite often. They do not repair leakage on time. It is moldy and recent in feed, in their feeding trough. It is okay for animal eating moldy thing 1 or 2 times, but it is not okay if your animal eats such kind of things always. The fourth point, apart from treatment on the course, we can actively take symptomatic approach. Rehydration against dehydration. What we give, most common is normal saline, 0.9%. If you want to supplement amount of energy, then you can simply choose glucose in normal saline, 5%. I mean, this is for infusing. If you want to give it by drinking, simply use oral rehydration salt, like this one from our company. If it is unavailable in your market, you can prepare it by yourself. You just find some salt in your kitchen, blending it with baking soda, with some glucose. And here is its ratio. And also you can find this ratio through Google. Apart from this, there is abdominal cavity administration. You can also find its detailed handling through Google. It is an easy and effective method for animals of small weight. Many farmers always ask me how many liquids should be given to dehydrated animal. I think in principle, the more is better than the fewer, as long as their internal organ is functional. Someone like a human being, can you tell me what is the difference you take 8 glasses of water a day and 10 glasses of water a day, right? There is no difference. The maximum, the difference is that you go to toilets quite often. So it doesn't matter about the quantity. The most important thing is give liquids to dehydrated animal. And generally speaking, I think to adult cattle, average 2 to 4 liter can be supplemented. And to calf, I think 1 to 2 liter is appropriate. If there is fever, then anti-fever. If there is explosive diarrhea, then relieve intestine. If there is acidosis, then rectify acid. You can rectify acid by simply adding baking soda 5% along with your infusion. If there is heart failure, then we use cardiotonic medicine like caffeine sodium benzoate or sodium kaffir sulfate or adrenaline. Besides this, in diarrhea, the nutrients they are lacking is vitamin B and vitamin C. So, vitamin C and compound vitamin B can be added during treatment. But caution should be made on vitamin B1, where the amount should not be big, because vitamin B1 can accelerate the movement of the intestine and sometimes make diarrhea worse. The fifth point, I think this is applicable to all grouping disease. Under such situation, we need enhanced management, enhanced disinfection, and keep our animal warm, especially to infants. They are easy to have diarrhea if getting cold, and keep our water and feed clean and free from fungus toxin. In case of diarrhea, we also need to reduce animals' food and feed intake. Regarding medicine administration, we can choose intramuscularly, IV, and in China we have acupoint injection. To diarrhea, antibiotic injection on whole high point under the tail usually can give you a better results than injection on the leg or hip. About 5 points is for your reference. Pay attention to fountain and enjoying an easy farming.